And still on health matters, the importance of health sector funding was once again brought to the fore as the National Association of Nigerian Nurses and Midwives opened its national conference in Abuja. The conference was also an opportunity for nurses and midwives to motivate themselves to a higher professional calling. Moyo Thomas reports.
The call to serve humanity cannot be more daunting than during this period, where the world is battling a deadly virus. In the forefront of this battle are healthcare workers. Despite all precautions, the pandemic has greatly affected them, especially as they have not been provided with adequate equipment. At this conference, they decry the work conditions they are subjected to, the inadequacy of their insurance covers, hazards and inducement allowances.
I'm aware that despite lack of motivation, and even in some cases, payment of your entitlement, because I'm aware that in such a situation, health workers globally have been entitled to hazard and inducement allowances to encourage them and motivate them to continue to do more. In some countries, it's even up to 50%. I'm aware that as we speak, in second wave, there are many areas that are not paid. And I will urge government to try to respect those understanding that we have actually reached, including with the unions, to try to make sure that you are well encouraged.
About 800 health workers have so far been infected with COVID-19, and they appeal to government to do more in improving the sector.
But the only thing is to allow all the PPEs to be readily available, at level, from the local government to the state to the federal health institution, so that at every given time when you are going to care for any patient, those things should be there. They should be available for us to care for the patient.
Taking care of the patient's bill and what have you tends to be very difficult, especially for people that are poor and doesn't have enough financial standing.
This doesn't bode well for a sector where medical personnel are not enough and the country has high infant and maternal mortality rates. Health indicators in Nigeria are generally poor, as the country ranks 7th among countries with a shortage of health workers. At this week-long conference, the Association of Nurses and Midwives will deliberate on how to ensure the growth of the sector despite all odds. The conference is once again an opportunity to remind the federal government of the importance of the welfare of nurses in the continued fight to curb the spread of COVID-19 in Nigeria. Moyo Thomas, TVC News, Abuja.